But before that, joining Eagle News today is a geriatrician from Palo Alto, California, Dr. Minerva Navarro. Dr. Minerva Navarro, thank you for joining us.
Thank you for having me.
Dr. Navarro, you are a geriatrician, and that means you specialize in services in senior care. Amid the spread of coronavirus, COVID-19 across countries, how do you handle the pressure, especially those that you care for are categorized as higher risk patients when it comes to being infected?
It is not surprising that the senior population is the highest risk with this new virus. It is really supported by the physiologic changes in aging that seniors would have a lower immunity than the rest of the younger population. Mm-hmm. So as we learn more and the information evolves around COVID-19, all the healthcare professionals, including geriatricians, we follow the same CDC guidelines, mm-hmm. State public health, and most especially local public health recommendations. So since the healthcare system resources are also scarce, we started triaging the care for the seniors. We started offering virtual visits, phone visits to minimize the physical exposure risk, both for the senior itself and for the healthcare workers. Mm-hmm. The other thing that we're doing is we have been building policies around care for seniors, especially for these senior communities, mm-hmm. like skilled nursing facilities, assisted living facilities, independent living facilities, where there may be communal areas mm-hmm. For the seniors and families to congregate.
Thank you, Dr. Navarro. Is it true that those who are asymptomatic are more than likely carriers of the virus too? And then since they're asymptomatic, we can't really tell if they're infected. But how dangerous is that when it comes to our senior population?
Again, as we learn more about this virus and the CDC and the public health provides us evolving information, we are learning more about asymptomatic cases. Mm-hmm. And as you mentioned, because they have no signs of symptoms, they become much more dangerous in terms mm-hmm. of public safety. And this is the reason why many county public health has adopted they call homing shelter, or staying at home as much as possible and just doing businesses outside your home when it is essential. So we are still learning a lot about this virus. What we can advise is if you have no business going outside, stay at home, and obviously you would like to minimize your exposure with anyone other than what is necessary.
Okay, doctor, if you suspect you have the virus, if you're showing symptoms, which are flu-like, that's what they said, what should you do first?
Regardless of age, mm-hmm. I would say definitely if you are showing any respiratory symptom, okay. So make sure you call your provider. Mm-hmm. Your provider can advise you. So the healthcare system, as I said, is being tested right now into innovative ways of seeing patients outside mm-hmm. the usual brick wall buildings mm-hmm. as we speak. And so when you call your provider, there will be several ways that your visit may be addressed. Mm-hmm. So obviously we would like to triage mm-hmm. the care based on your risk factors, your symptoms, because there are higher risk symptoms, and obviously your other comorbid situations. So right now we're offering, most organizations or medical groups are offering phone visits, virtual visits, drive-through visits, segregated respiratory unit visits, and we're also postponing other non-elective visits. So go seek out help. And then after you have contacted your medical provider, it would be good to isolate yourself, not just home isolate. If you have other people in your home, it may be worthwhile getting yourself in other, in a separate unit in your home, or a separate room in your home. Obviously, just follow the universal precautions as everybody else talks about. Those are my main advice.
Okay, Dr. Navarro, what about preventive measures? Some are asking, since there's no cure yet, or it's the virus is still being studied, what preventive measures or could we take? Let's say, for example, when it comes to things we eat or exercises that we do, are there things that could help?
Generally, obviously, we follow healthy lifestyles. We are less likely to be affected by, infections, whether they are old infections that we know, like influenza, or novel viruses like the coronavirus. So having that balanced meal, throughout the day, drinking water or fluids if appropriate for your care, 30 minutes of exercise, sleeping enough, which is very hard to do in the United States. And then obviously universal precautions, as I said, some of these things are not really new. Hand washing, covering your mouth, making sure that you stay away when you're sick or stay away from sick people. I would say respiratory infection general respond well when you have good vitamins intake. So those vegetables, fruits, they work quite well. They work quite well with your immunity as well as proteins.
Dr. Navarro, we know you're a very busy lady and you have a baby also. Before we let you go, one last question. People are scared right now, especially because there's a lot of unknown about the behavior of the virus. As a medical care provider, how do you address your patients' fear? Especially, we've mentioned earlier, they belong to the higher risk category.
So, getting the right education is one thing. There's so much social media out there that may create panic and fear. I would say if you would like to know more, get in tune with CDC, your state public health, and obviously your local public health guidelines. Many public health has set forth ordinances that are legally enforced. I would say be good citizens, follow the ordinances, and use the support of the community. We are stronger than this virus. Get connected with your family, hopefully virtually. If you have ways to getting in touch with your family, not necessarily to be there physically. And then we just have to support each other. If you do have questions for yourself, there are ways to get hold of providers over the phone. There's also resources from the state and the local public health in alleviating fear from the public. And these are usually phone calls, and they can let you go through it. So feel the community, Let's be a community as we go through these new times.
Thank you very much for making yourself available to Eagle News, Dr. Navarro. We hope you could join us again next time.
Thank you.
There we have it.